What if we told you that too much of a good thing can be bad? Yes, even with vitamin D. Now don't get us wrong, vitamin D is undoubtedly essential for our bodies, aiding in calcium absorption and bone health. But let's take a moment to talk about the other side of the coin, the risks associated with excessive intake of this sunshine vitamin. You see, our bodies are like well-oiled machines, designed to keep everything in balance. Too much vitamin D can tip this balance, leading to a condition called hypervitaminosis D. This isn't a term you hear every day, is it? But it's as serious as it sounds. Hypervitaminosis D can cause a range of symptoms, from nausea and vomiting to weakness and frequent urination. And these are just the short-term effects. If we delve deeper into the long-term effects of excessive vitamin D intake, the scenario becomes even more alarming. Vitamin D toxicity can lead to bone loss. Yes, you heard it right. The very vitamin that's supposed to strengthen your bones can cause bone loss if taken in excess. It's like inviting a guest into your home, only to have them wreck the place. But the damage doesn't stop there. Our kidneys, the silent workhorses of our bodies, can also bear the brunt of vitamin D toxicity. Over time, excessive vitamin D can lead to kidney damage, which is not something to be taken lightly. So the next time you reach for that vitamin D supplement, remember, moderation is key. After all, it's a fine line between just enough and too much. Now that we've unveiled the risks, let's delve into the myths surrounding vitamin D. Trust us, you'll want to stick around for this. It's time to separate fact from fiction. Myths about vitamin D have been circulating for years, but how many of them hold water? Let's dive right in and start debunking. A common belief is that vitamin D, our sunshine vitamin, is a one-stop solution, preventing a whole host of health conditions. Sounds too good to be true, right? Well, that's because it might be. Recent research findings have thrown this belief into question. A study led by Dr. Manson, involving over 25,000 participants, found that taking a vitamin D supplement did not lower rates of heart attack, stroke, or cancer. You heard it right, folks. The miracle vitamin might not be as miraculous as we thought. However, before you toss out your vitamin D supplements, let's add a twist to the tale. Participants who developed cancer and had been taking vitamin D supplements for at least 2 years had a 25% lower chance of dying from their cancer compared to those who received a placebo. Now, don't go popping vitamin D supplements like candy just yet. The research here is still ongoing and far from conclusive. It's crucial to remember that while vitamin D plays a role in our overall health, it's not a magic potion. Factors such as where you live, your age, and even your skin color can affect your vitamin D levels. For instance, if you live in the northern states, you're at higher risk for a vitamin D deficiency because your skin may not be able to produce any vitamin D from sun exposure during the winter months. Similarly, your skin's ability to produce vitamin D drops with age. And did you know that people with darker skin typically have lower levels of vitamin D than lighter-skinned individuals? So we've busted some myths, shed light on the fact that vitamin D isn't a cure-all, and highlighted the need for more research. Myths busted, let's now explore some healthier alternatives. Overdoing vitamin D can be risky, but are there safer ways to ensure we're getting enough? Absolutely. Let's delve into some healthier alternatives to excessive vitamin D supplementation. First, a balanced diet is key. While it's true that very few foods naturally contain vitamin D, some are fortified with it. We're talking about fatty fish like salmon and mackerel, beef liver, cheese, and egg yolks. Certain mushrooms are also known to contain vitamin D. And let's not forget foods fortified with vitamin D like some dairy products, orange juice, soy milk, and cereals. Now, we can't talk about vitamin D and not mention the sun. Our bodies are designed to produce vitamin D through moderate sun exposure. In fact, it's been nicknamed the sunshine vitamin for this very reason. So get out there and enjoy the sun. But remember, moderation is key. Too much sun exposure can lead to skin damage and an increased risk of skin cancer. Another healthier alternative is regular checkups. Regular blood tests can help monitor your vitamin D levels. If you're deficient, your doctor can recommend appropriate supplements or dietary changes. This approach ensures you're getting the right amount of vitamin D, tailored specifically to your needs. Age, skin color, and geographical location also play a role in your vitamin D levels. For instance, if you're over 65, your skin produces less vitamin D than when you were in your 20s. Similarly, people with darker skin typically have lower levels of vitamin D. If you live in northern latitudes, your skin might not produce any vitamin D from sun exposure during the winter months. So, keep these factors in mind and discuss them with your doctor. In conclusion, it's not about loading up on vitamin D supplements, but rather about maintaining a balanced diet, enjoying moderate sun exposure, and having regular checkups to keep track of your vitamin D levels. With the right knowledge and approach, we can harness the power of vitamin D without the risks. So, what have we learned about the sunshine vitamin and its dark side? Well, we've delved into the complex world of vitamin D, often hailed as the sunshine vitamin. We've discovered that while it's vital for bone health, helping our bodies absorb calcium and phosphorus, it's not a magic potion. The research into vitamin D's role in preventing other health conditions is not yet conclusive, with mixed results in clinical trials. We've also debunked some myths, notably the idea that more is always better. While vitamin D deficiency can lead to bone diseases like rickets and osteoporosis, overconsumption is not without its risks. The balance is key, and going overboard with supplements can lead to potential complications, such as kidney problems. We've also explored how various factors affect your vitamin D levels. Your geographical location, age, and even skin color can impact how much vitamin D your body produces. Those living in northern latitudes, individuals over 65, and people with darker skin are more prone to vitamin D deficiency. But it's not all doom and gloom. We've discussed healthier alternatives and ways to maintain a balanced vitamin D level. Sun exposure, fortified foods, and regulated supplements can all contribute to healthy vitamin D levels, provided they're used wisely. The takeaway here is that understanding vitamin D, its benefits, and potential risks are essential for making informed health decisions. It's about finding the right balance and not falling for the trap of more is always better. Because, as with most things in life, moderation is key. Now that you're aware of the risks, how will you approach your vitamin D intake? Share your thoughts in the comments below.